The use of both systems, Epic and Priority Consult, really is very essential. The difference that I see, or the impact that I see mostly, is that Epic has all of the charting wherever the patient has information obtained through the St. Elizabeth system, but Priority Consult is specific to our spine center. So basically it's easier for me to find just that data through Priority Consult, and I don't have to go through all of the records like I would in Epic to pick what I needed specifically just for the spine information. So it does help me keep that information all together, and then it also lets me document and see any phone calls that have came in and any questions that they have specific about spine. Going through the Epic system, it can get a little, with all the information, it's great because you know who they've talked to and who they've been in contact with, but it's a little harder to just kind of sift out what you need. The benefit that I have now is that we do have the same demographics, and that I do have the same information whenever I'm calling a patient. So it's actually easier for me to access it through Priority Consult. It's easier to pick up their name and the insurance information. So it's all there, and that information is all the same. So I don't have to worry about if something is changed, that I don't have to change it in both systems. When it's changed in Epic, then it's changed in Priority Consult. So that's the main benefit right now. Most of my phone calls I put into Priority Consult, and then that way the only extra documentation I do in Epic at that time is if it's very specific to, like, sending them to the emergency room or something like that, then I would put it in both records. But the Priority Consult is where I put most of my data. Priority Consult keeps everything very organized for me. I have different screens that I can go to, and so I know when intakes need to be done on patients, and then I have a follow-up screen as well as outcome screen, and all of those have dates that I have entered, so it helps me keep track of every specific area that I need to contact them. Where Epic is like a total file. It's like an open chart without paper. So, you know, I do have tabs and screens that I can go through, but it's a little bit more time consuming to just find what I want. Learning both of the computer systems wasn't as difficult as I thought it was going to be. I at first kind of panicked because I am not the best computer person. And so when I was introduced with Epic, you know, I had it on board about a year before I was introduced to Priority Consult. So before I really felt comfortable with Epic, I feel like it took me about 6 months and still there's many things that I learn and I'm not familiar with. But Priority Consult, it was much easier than I thought. It's much more user-friendly. It's much more specific to what I was going to do in my position. And, you know, I don't want to say it's repetitive, but once you know the flow, it's very easy. What I find is that I usually pull up both records at the same time, so I can look at Priority Consult and Epic at the same time. I've not had too much problem with duplication or you know, any trouble finding anything, or even interfacing. Like if any of the information changes from one to the other, it's updated the demographics and insurance. So I really haven't had any problem that I can put my finger on with having the two different records.